he cleans it up correctly. You just, oh, doctor, you're a miracle.
I told him one day, you know what I'm going to do? I'm going to start doing all of them. I've never, other than, I was sort of open the mouth of your mouth. No, I'm going to do all of them. It's part of my part.
Nice, that's so great.
And I'm going to start looking for things.
I need to do it because my natural pet doctor tells me he looks in their mouth. And I know he doesn't. I know he doesn't. I would have tons of patience, But he does have one thing correct, People are like, well, does he take my insurance? That's the first question. And I don't take insurance. I bill their insurance for them, but it's a stopper. But at least if you open their mouth, you look and you say, oh, I'm going to have trouble because you got that stuff in there. But hey, take this. If that doesn't work, we should stab it. Well, if you want to keep that poison in there, well, I got to fight poison with poison. You got to take your time with these people because we can't shove it down their throat. It takes, for the dentist, it will take us a long time sometimes to accept that fluoride. Oh, fluoride. I don't know what I do without fluoride. It's a vitamin.
It's an essential nutrient.
So what are you going to do with that? You have to take it in baby steps with some people. But most of our patients come, they're more educated than me. They're more educated than we are. Or at least they think they are. Hey, good morning, dear. You made it all the way to the end. I'm proud of you, dear. Nice. Good morning.
Good morning.
I have no idea what time it is. It must be past 5. We always have to start late, so I'm waiting till after.
Well, the elevators are there's one elevator today.
One, I think, right?
But they turned 2 of them off or something.
Yeah, and so everyone's out there waiting forever. I know what that is. That's a test to see if you're actually toxic, because if your blood pressure is going up because you're waiting an extra minute, you know that you probably still got it, And you're like, oh, no, so get back into the nurse, so that's true. I know my own observation. When I was so toxic, something like that could just blow me away,
Serious, huh?
You're angry for 10 minutes, about waiting 2 minutes, and
It was 4 minutes of somebody on the elevator.
now there's reason. But it's funny as the mind clears. Some things that like that kind of So I don't. When somebody cuts me off on the highway, I don't miss anymore. No, I don't even do that. I get away from them. That's a sign of clearing your mind. Because you don't even get the hand anymore. And it probably saves lives. So it's smart. It's a good way. Okay. When I figured that kind of thing too, you won't join into that. Well, good. That's great. How are you doing?
I'm good.
All right.
I figure I always have something going.
Well, you look like you're well rested and you're ready to learn some more. I love that. So in here, I assume we probably have, everything from first time meeting to we have full seasoned practitioners. So I hope that anything that you can add, this is more about I want to help and answer, and we have some people that are here that can help and answer anything that you're feeling nervous or upset about. I mean, I talked to one girl for a while, a couple of days ago. She was almost going to cry, you know, because it's like such a jolt. So we can have that kind of experience. But for me, this is my information and my email. You guys, please copy it down. And I would like, we were talking here before. If you'd like to join in, we're going to maybe create an email thread with everybody's name on it and exchange what we're kind of doing for different procedures. Just talk. I'm an emailaholic, and so I love to get email, and you might find that it's beneficial for you to. Yes.
I have 5,000 emails in my email box, 4,300 people. So clearly email doesn't work for me. Is it possible to sort of create, I have created a Biological Dentistry 101 group for non-dentists. Is it possible for us to sort of create that similar thing on Facebook, a Biological Dentistry 101 for IAOMT members?
If you want to do that, please, thank you for doing
I
it.
would be happy to do that because that makes it so much easier, and then I'll add you, and we can be admins, and it's all good. And
I would love that.
5,000 emails.
But we do have some people who refuse Facebook. So, I mean, that we've talked, we've talked about doing this, and it was decided you're leaving some people out if you do Facebook.
What about our
Some people
forum?
have to do email.
What about the IAOMT
You
forum?
do have a forum that's not used.
It's very underutilized.
And so we do have, if you check onto the website and sign in, you can go to the forum and you can
Yeah,
totally
it's
post there, but it just seems like there's something there. There's a thing that says, don't use what we're talking about. Subconsciously. I think that they.
Just have it.
It makes it too hard. Like, you know, I understand there are some people who just don't want to use social media, and I get it. But I have 4,350 emails.
Stop writing so many. Do the important ones.
I
Do
don't.
the important ones.
I don't write so many. I promise. I don't write any of them. They find
I would say create it, but we're also going to create an email group, and then just have a group on there.
hours.
And then, but also I would love if you would create that, and let's see how that works.
I can
You know?
do that.
Is anybody here not do Facebook? 1, 2, 3. There's 3.
There's 3.
That's 3 very important people. So
There's 3 that are experienced.
Look at I've been to Facebook hell, so I understand. So that they call me was that's that. Please, we're all friends in the academy. So, oops, there's my cell phone number. Please take it anytime. I don't answer usually during patients, but I'll take the call. It's it's almost attached to my hip, except for
Boss, is your email address case sensitive?
no. It's email address for others. I don't know. I do that. But, no email addresses are case sensitive that I know. That I know. So, yeah, please copy that down. Please call me. I need the love, okay? Oops. Thank you for coming. Well, all right, it's over. Restart. Here we go. So we're here for biologic dentistry, and for me, I think we try to make it simple, and we're looking for this whole body everything we do, we're thinking about what are we doing to the body. In the academy, of course, we want everything to be science-based, which is kind of different than holistic. We have biologic, and so biologic is to do things. You can do whatever you want, but as far as the academy goes, we try to reconcile things that are scientifically based, and everything is wide open to do it, practice how you like. And but if you're doing, muscle testing, nice. A lot of people are doing it, but I think you're going to find a lot of some others that say, that you're crossing the line. So if you got a sure method of that, I'm always listening. So my patients oftentimes want to do muscle testing. I just give them the stuff. I say, go ahead, let's do the blood. And come back and you do that, and we'll see how it compares. I would say it's surprisingly it's oftentimes close, to what we find on the testing. But I think so. Basically, we're learning at the science in the academy. These are the things. This is it. And it's pretty simple. These are the topics and basic topics that we address, and so what are we speaking? It's a lot of stuff. So, but simply stating is bioaccumulation, and then you'll have to decide: are you going to get involved with detoxification? Or, like what I was saying earlier, that for me, I have a natural path that most of my patients, because people come to me because they're sick, I'm sending them for help from the natural path. Here, he has MD, they're lucky. But if you're not, for a long time, I did it myself, and I tried to help them, and I still do. It seems like a simple case of detoxification. And, for me, it makes it simple to use Quicksilver. I mix some things because I kind of say, okay, my story to my patient is, this is how I did it. And I give them the recipe of how I did it, because we really them out to lunch or find dinner. They have more money than me, but I do it anyway. Or if you're building an office, you have none.
I was just going to say, Quicksilver has the Mercury-Free test, and I think it's good information. But they also offer a test for heavy metals. It's the Melissa test, and so you can order
Through Quicksilver?
Yeah.
Oh, really? This is something new?
I've been doing it for a couple of years.
When you say, you mean the ELISA test?
ELISA test
Which-
is
Pronounce it, yeah.
Well, my understanding was, because we just had some contact with the originators of that test, that there's nothing available in the United States right now.
Oh, okay.
So we might need to clarify that.
Yeah, in fact,
At this meeting, we were checking with a couple resources to see who we might be able to get that started up and available again in the U.S. because the lab that was doing it fell apart, and trying to ship stuff to Europe for testing over there is a nightmare. So we're trying to reinvigorate that.
Okay.
Yeah, so that's the ELISA is the metals, the D metals test. And this is, my understanding and my research was that they want you to send it to Europe. And I think it is, is it in Switzerland where they are? Or
Sweden.
Sweden.
Yeah.
They're the same, right? But you can call them, they're beautiful people to talk to. But you have to get it there overnight. And I figured out from Massachusetts I can do it overnight. If you're like, take the blood at the UPS post and you ship it, and it gets there just in time, and they can do it, and you can have your patients checked. So that's looking for general metal sensitivity, and that could be for your crowns, for your the amalgam, mercury itself, and the implant problems, of course, And that's really the only full metal. The Quicksilver offers that tri-test, and I agree, it can be valuable, and for mercury, it's limited to mercury. And
Well, unless you do the metals panel. They do have a metals panel.
that's what I said,
but
I don't know about this.
But all it is just the levels in that person, and I think it's the blood.
That's right.
But
It's
the
a
test,
blood test. It is
yeah,
a blood
blood test. Yeah, but it's
Oh, it's a
not.
straight-
It's not
it's a
telling you
straight
It's not telling you about that patient's sensitivity to it. It's just saying what the levels are. So the
So
ELISA gets more into the sensitivity issue.
yes, yes.
And-
ELISA is a reactivity.
Yeah, it is a bit different than Clifford's test or Blanche Ruby's test.
Yeah, the Clifford test is, you do the Clifford to see if they have the presence of antibodies to a group of chemicals, and then it's extrapolated to all of the dental materials. And certainly a person who's hypersensitive, you want to make sure they do the Clifford. I'm kind of lenient, I don't make everybody do it. I try to make sure that all of my materials are the ones that Jess Clifford told me never show up.
Yeah.
So, it's, you should try, I try to, at least I would advise, at least you make it available. You just
Okay.
tell them you want some boxes, you put it there, you have the Clifford. Going in, you know that it can be tested, are you already sensitive to these things, and you can avoid it. But then if you want to know, are they actually reacting to that implant? I'm being aware of what they are. And do you get any radio waves from Europe? Because those metal implants are seemingly, eventually, always showing up to be a problem, because they all 100% have nickel. 100% of all metal implants have nickel. And I've been told by people who are much smarter than me that if you're not allergic to nickel, just put some in your body and eventually you will. So I think that, the metal implant thing and your patient having chronic problems, I'm sorry. And now you're now aware it's not just the metal implant here. It's the metal implant here. It's the metal implant here. And they're all the same. They all have this problem. They're some worse than others. And so we're coming out with a new metals paper that you people are going to be like, oh, because every metal-based crown, it's trouble as far as what it's doing to you systemically. Some people don't show it, of course, they are stronger. Maybe they have what is it, 30% that have a perfect MTHFR, yeah, we got to be aware of that. I think, and you don't have to do Quicksilver. There's other, you can do what you like. But I was saying for us, what we can do as dentists, it helps to have something you can just say here, try this. And
I have a question about
yes.
biocompatibility testing. How is that discussion started with the patient? And number one, started with the patient, and number two, how is that fitted into the process of billing and its
Okay, so you're saying, so we have a new patient, and you are sensing that they, or you want to know, are what they have biocompatible now? That's Clifford test. Well, you have to find out, do you know what materials were in this person's mouth? And then the test, you just give it to them, they have to go to a lab, make sure you sign it, and give it to them, and then you'll get that report. And then you can check to see, okay, you have these composites that this guy did. If you have a rare instance where they actually wrote something down, and then you say, hey, you're reacting to these composites. They're definitely part of the problem.
now does their insurance cover?
No.
So this is like a
No.
out of pocket.
Out of pocket, it's like $300, it's a little less. It's like $300. Most of my people don't do it, but some choose to do it.
It's more.
It's
more.
Is it more now?
$375 now.
200 and something.
$325? So, yeah, and it's not, no, it's not local to insurance as far as I know. You're pointing out, I don't know very much right now. Yes?
I also charge $40, and that's just for an assistant to go through what they are sensitive to and not sensitive to and sort of figure out what we use in our office.
I do too. I call it professional interpretation. And then there's a phlebotomist fee. So it gets up close to $400 all said and done.
Maybe what I do a lot of allergy testing for my patient.
Yeah.
And heavy metal is one of them that I do. And so insurance medical on the medical side, insurance pays
For the metal testing.
Yeah, there's a whole panel of requests that we can do, all genomic diagnostic, and the insurance pay up 80%.
But here's the problem with, according to Melissa, those tests are not valid for metal. Because metal is not antibody, it is primary cell attack. So you have to look at mast cells and you're checking. So
So you have to use that.
yeah, so I think that you have to use Melissa. This is the whole thing. And that they brought out that it's really, everybody's been looking for antibodies to the metal, and there is no antibodies. The body reacts to metals with cellular defense, you know? So, are we ready to go into the vitamin category?
Just one more thing. The Clifford test gives a really easy to read report, and it's by brand name of alloy. You know, most of your dental metals aren't a single metal, so it's really the alloy you want to know by brand name specifically, and that's what you'll get with Clifford.
Yeah, and the Clifford, but you know, the whole thing that we have to understand, Clifford is an antibody test. So it's not a true test for metal. So just because you get a Clifford and it says that the metal is okay, it's not really, it's not valid at all. So I look, if I really have to know, I would have to run a Melissa. And for me, you know, I generally am not end up doing a lot of testing, you know, because we're usually talking about it, and for me it's symptoms, but you have to decide what you're comfortable with, you know. And yes, I'm sure that I actually had a person just recently who has Lyme, which is a whole other story, but so their doctor said the metals in her mouth was part of the huge problem, and her medical actually is even paying, has said okay, and then they're paying for me to take out all of the metals from her mouth. I've never heard of
to do that.
That's like, well, here's what happened. So she sent it in, they left it on the desk, they have to reply the next amount of time, and somebody found it under their pile, and then all of a sudden they just said, okay. And now she got that okay, but she did some research and she kind of found out that was why, because it was kind of a rush thing. But I'd love if we could get that going on. You know, you can let us know.
Come on in.
You can get that. That would be like.
And just take any available seats.
You know. Come in. Do we need more chairs? How are we doing?
You got
that one and that one.
Right here,
All right.
here, and here.
Yes.
How much do you charge for teaching
So the question is, how much do I charge for to remove a mercury filling? So. SMART certified, and I encourage and hope that you all have started that process or will be thinking about it. So for SMART removal, we have a fee, and it ranges in everyone's office. I've heard as low as like $40 per visit to $40 per tooth to $300 per visit make it up. Whatever you feel comfortable. For me, it's, I charge per visit, because then it motivates your patient to, okay, let's get this stuff done. And you know, it gets old putting this stuff on and then pouring it all away. So let's get it all done quick. So I charge per visit $60 or something. I give it away.
How does the amount?
That don't matter how much. But there are people who charge per.
Yeah, I charge $150 a quadrant for my smart removal. So if they've got 4 amalgams or 1 amalgam in a quadrant, it's $150 per quadrant, right? Oh, okay. Oh, we now charge $300. Oh, wow. But,
So,
you know,
yeah, you know, like I said, I think I give it away.
So
But
it encourages them
it's
to do all of their amalgams on that quadrant at the same time instead of one at a time.
Yes,
You know?
yes. What you're really, it's helping the person because they're, but then at the same time, if they can only afford to do one at a time, it's a double burden for that person. So, you know, it's tough.
Well, and we do have our mercy fees, you know, where we lower the price and so on and so forth, but at the end of the day, it's such a pain in the butt. And like, you have to pay for all of your smart removal stuff.
Right.
You have to understand that. I mean, those spacesuits aren't cheap, you know, and the lumping machines, we call them lumpy because they look like they have a lump, you know, the vacuum thing, that's $1,000 a pop, and we now have 2. You know, we just bought our second one because there's 2 doctors. You know, just all of those things are just so expensive. And honestly, being a biological dentist is expensive. It costs us more money to have to do everything. And so the smart removal helps us to that smart removal fee helps us to offset the costs of some of the other things that we do. So it, you know, it just
Yeah,
is what it is.
it's you have to decide what you're comfortable with, and certainly it takes us, the biggest cost of doing smart is how much extra time it takes you.
Yeah,
So it takes time. So set your fees so that you're comfortable with it. I don't know, if you want to drive a Maserati, then they gotta be higher. You know, I drive an old Volkswagen, so.
Right, but I mean, it also depends on the cost of living where you live.
Yeah, it's different, so it's hard to say.
That you're paying your lease space and so on and so forth. I'm not rich, I'm never gonna be rich, you know, but I live in a very well-to-do area, you know, and it's expensive. Our rent, just for my office, is over $10,000 a month, you know. Yeah, exactly. So yeah, my fees are high, you know, because I gotta pay for that stuff.
Yes.
What do you title that fee?
Pardon?
What do you title that fee? What do you call it?
Smart.
Patients who don't want to pay for it.
Smart removal fee, and for Mercury, this is how we do it, and if you come to my office, this is what it's going to cost. It's not an option.
Yeah, because we're not going to take any less precautions for ourselves.
No, I mean, it's not an option, it's just like, this is how we do it, and that's why you come to me. So forget what my advice is, stop thinking about fees. Set them where you know that you make an X amount per hour that you're comfortable with, and stop talking about fees to your patient, and start concentrating on biology.
Is there any controversy when a patient says, well, the dentist up the street doesn't charge this fee?
Don't, so go there. I don't have time anymore. I'm sorry, I won't even charge you for your visit here. Here's how we get rid of it. This totally takes care of the problem. Number one, I always had a problem with people showing up for their initial visit. And I didn't want to go to put your credit card down and it would be fine. We have, you have to come to my office. You have to fill out a form of all of your history. It's like 7 or 8 pages of a form. And then we will call you after the doctor reviews your income, and we will call you to make an appointment if we can help you. And so that's how it happens at the beginning. And you can see right there, from the questions you ask, you never have a patient that's going to want to go down the street and question the fee. You want the form. And
the radiographs, ideally. If they have radiographs, because I hate it when, they don't want to do x-rays, and they're sitting there and you're trying to treat the plan, So we don't make the appointment until we've got their x-rays.
Yeah, or we're planning, or we're gonna capture those x-rays at the first appointment if they don't have them.
Exactly.
Do you have any way that you could share your forms with us? So
Yeah, no, I'm gonna give you that, how you can get the form thing put on your site.
My question is that.
Yeah, Talk International has this thing. I thought of it. I should get it. But I'm not, you know, and that you can self-design. They put, you know, like some yoga kind of atmosphere and then fill out your health history and more, you know? Where did you work? It's extensive. It's very extensive, and you have, and then like all of those new medical medicines that I have no idea what they're for. I don't have to turn red in front of my patient, or no, I don't know what that is. You know everything. Everything that you know, everything that you don't know, you'll know by the time before they come. So it solves a lot of problems, and we have. I used to be able to say we have 0 no-shows. I think we have 1 now since we started doing that, and so I think it's a good idea. The fluoride problem, it was, for me when I started, was the last thing that I accepted, you know? When I found the academy, I thought they had it right, but I knew better about the fluoride. It's obviously right. But now, do you guys, are you still questioning, or are we comfortable just saying it's poison, we don't use it?
There was a small little part where you said the whole topical aspect of fluoride, which I think, I forget the professor.
Well, so you know, I think it's, I call it the whip effect myself, but when we had to, when we argued with these people about not putting the fluoride in the water, all right, and they had to kind of slowly but surely, after decades and decades of arguing, they had to admit, yes, okay, but if there is an effect, it's because they're drinking the fluoride and it's constantly mineralizing the teeth. So having it in the water, if you never drank it and you swished it and spit it out, I guess there could be some benefit. But if you didn't do that, your body's minerals will do the same thing. And if you do that, just doing you're taking in fluoride. I mean,
you can't not swallow it, even if it's topical. You can't not swallow it.
Yeah, I mean, so there is if we have to wimp out and say, okay, there's some benefit, it could be that when it goes through your mouth, topically, but it's really not a benefit. It comes with side effects. So that's it.
Yeah, like for me, I was using SDF because I could not figure out another way to because it's not the fluoride in the SDF that does the work, it's the silver. And for a while, I had just sort of made my peace with it. I was like, it's more beneficial to the child to just stop that decay in its track than to continue to let it decay. Well, now I know that I have other options, and so now I use silver nitrate and I use potassium iodide instead of SDF.
Yeah, you can get rid of the fluoride, but you know the mainstream now is of course the fluoride and SDF. But I like this. If you really want to do this, if you're doing this in children, that's a viable. Probably at this point, we haven't studied it, but at this point, probably more viable stopping the decay thing is just to use.
And I knew that once an SDF was, like they proposed to use SDF like once every 3 months, and so on and so forth. And I'm like, I was only comfortable using it just the one time. And honestly, I found that just the one time was enough, But I feel much more comfortable now using the silver nitrate, and I apply it twice, and I apply it first, and then 3 months later I'll apply it again. But I don't feel this like a compromising anymore, because it's always the silver that does the work. It's not the other stuff, But I'm not going to poison anybody by. Like I said, it was one of those things that I was like, okay, it's a one-time application. it's topical, it's a spot treatment, I only put it on, you know, you start to reason with yourself and you start to talk to yourself. And if you have no other option, then you don't. But Henry Schein does sell the silver nitrate, 25%. And so it is possible to do something else that doesn't have the fluoride. I just needed to know that I was not the first. But in one of my classes, one of your mentees told me that they did it in her residency program. And so at that point I was like, okay, I'm good. You know, I don't ever want to be the cowboy that's the first one. I have no desire to be the cowboy. I want to know that something has precedent. You know, and now that I know that silver nitrate has precedent, I'm good.
Oh, well,
Okay.
well.
Yes.
So I was like you. I was loath to give up on fluoride because I couldn't believe that I would have been lied to. I mean, you know, that they're teaching it in every dental school, and what motivation would they have to do that? It was when I saw there's a book called The Fluoride Deception, and there's a movie made of the fluoride deception where they're interviewing Christopher Bryson. And it was when I saw that I really understood how it came to be the institution that it is in our country. So I would say if any of you are on the fence about that, get a copy of the Fluoride Deception. And I think it can answer your questions and help you to make a stand. Because first of all, you have to defend it to your staff, and they still believe. So you have to,
Unless you do what I do and bring your whole staff with you.
So what do you do in your office then? Like, my mentor uses ozone. I can't afford, I just bought a CEREC, I can't buy everything at the same time.
No.
So what are you using?
You can do iodine. You can take the potassium iodide before you do anything. And iodine, they had it in the beginning class that first day on Friday, where iodine reduced the decay more than fluoride did. So you can do other things. You know, you can beat the tooth before you bond with iodine, and you're fine. You know, is ozone nice? Ozone's great. You know, but I didn't have ozone until last year. I've been a biological nurse for 6 years. You pick your battles. We try to find something cheaper in the meantime that will work for you. And you simply, you don't put the pressure on yourself. Do what you can and know that this is a growth process. Every single year I learn something that is paradigm changing for me. I am not the dentist that I was 6 years ago, and by God, I was a good dentist 6 years ago. I'm better now. You know, every year you will grow.
Yeah, it's-
People react with the iodine.
How do they react? They don't have a problem with it at all because they don't even know. We're not, does that make sense? It's iodine. It's a necessary nutrient for your body. You can't overdose on it or anything. And you're just painting it on the tooth.
But you can't overdose on iodine. Okay, so
Yeah.
iodine is, most people are deficient in iodine. And so we can send you some lectures from our previous meetings, which is a great source of information. And they are suggesting that iodine does a lot of things, including getting rid of lumps. So if you have a breast problem, lumps, and these things in the body, that iodine, you might be iodine deficient. And so iodine, yes, diluted iodine to brush a child's teeth with is one of the things that one of our guys, Maddie, he writes a script for it, and so they deliver it to them diluted for brushing the children's teeth to stop the decay, but also for our own health. Maybe you might think about taking iodine, but if you take it all the time and you're taking large doses, you should be monitored, right?
Yeah, you don't want to take large doses,
Yeah.
but you really,
Well, some people are, they're advocating for 50 milligrams a day, it's too much.
Yeah, well, 96% of them are missing iron.
Yes.
And absolutely, Dr. David Brownstein, expert on iron, treats breast cancer, lumps, breast disease, diagnosis with iron by just putting it in
Oh, by rubbing.
rub it in there.
Yes.
And me, I put 2 drops of iron
Yeah.
in my coffee every single day.
Lugol solution, and yeah, 2 drops, so that's 12.5 milligrams.
Does everybody know that IAOMT has a YouTube channel? And all of our lectures for, going back probably 15 years are available. And the way that the Academy operates this is if it's a lecture in the last 3 years, those aren't available except for people who attended and paid to go to that meeting. But anything older than 3 years are totally free. And Dr. Brownstein's spoken to us multiple times over the years, and a lot of his would be available. So you can, find the IAOMT channel, do a search for any of these topics, and you can watch a lot of these presentations.
Yeah, cool. Yeah, sure.
I have a question about so one thing that I was always doing that I don't feel like I have a replacement for is like when I have a kid with a permanent molar who I almost hit the pulp, and I want to put Fuji in there, so all you have to do. Or if I had a kid where I couldn't isolate to use composite, couldn't tolerate it, what do you put instead of isolate on it?
So, first, for me, I'm ozone certified. So, and I encourage you to look at that. You're going to find that people are seeking ozone. They don't know why. They just all of a sudden realize they don't want fluoride and I want ozone.
Right.
So number one, it's isolated. I always try to my best, no matter what, stop short of the pulp. I ozonate the surface with, depending on how close I am, but usually if I'm leaving a layer there purposely, I might try to ozonate as high as 50 micrograms. But alternatively, before I was ozonated, I never got too panicked. If you didn't have an exposure and you have an asymptomatic tube, I'm total etch and your bond and then flowable. And I had no problem.
So there's a product called TheraCal.
Yes.
Calcium silicate material.
Which I use the TheraCal if I actually have an exposure. But even if I have an exposure at this point, I don't put a whole lot of faith in the long term. But in a child, you have a great chance of it going for a long time before you have to keep an eye on it. So yeah, but there's no magic. And if you want to use a material, fine. I would encourage don't use a fluoride material, and do what you feel is best, and then go home and sleep good because. If you're doing as best you can every day, you're doing the work.
What I see, I'm a little paint with SDF with the silver nitrate. I'll paint that. If there's any, if I'm worried that it's going to hit the pulp and I would rather not pulp the tooth, I'll stop the decay in its tracks with the silver nitrate, and then go ahead and bond it with that.
How long? In that procedure. You put the silver nitrate on.
Yeah, 30 seconds.
And then wash it off. And then just proceed to bond.
Yeah, you put it on light cured.
Oh, it is light cured.
Well, it's not light cured, but what happens when you light cure silver nitrate or SDF, it turns black right away.
Oh,
so you see where it was. Right. And it just, at that point you make sure all of your margins are clean, just the way that you would with anything that's bonded. You make sure everything's nice and clean. And only the pulpal area is the part that is it's black, and then you just bond over it the way that you normally do, etch bond, whatever, but at that point your decay is completely stopped.
So this will be this kind of clinical information is going to be great on your Facebook group. No, and then you're washing it off.
Yeah, once
then you bond.
Yeah, I put the silver nitrate on. I light cure it. I make sure that it's, at that point, then I clean the margins up, which then also rinses it because we're drilling, right, when we're cleaning the margins up. And then at that point, you just bond it and clean the way and fill the way you normally would. I put a pulp cap on that, with a flowable composite.
So I have this question, it's been on my mind since last 3 years. Tea has a lot of fluoride, and these days a lot of patients are drinking tea over coffee.
Oh yes, tea.
So,
black tea has the most.
Yes.
It's not. I encourage them to go to white tea, but my wife, who's a tea drinkers? She said no one.
Right.
So, I mean, what are you going to do? It's a fact, and if someone's drinking a lot of tea every day, which I would say if you could get them, find a green tea that you like better, because I think it's probably not good to be having that, but I eat organic.
Yeah, encourage organic.
They eat GMO. It's not worth the conversation, but the awareness is good. You have it. It's probably not good.
Okay, but try to do it with non-fluoridated water, and try to make sure it's organic. So whatever they are getting is very little compared to what they were getting.
So the fluoride thing is so controversial. In the IAOMT library, and our position paper on fluoride, which has been done beautifully by Jack and Amanda. I mean, it's like, if you have questions about fluoride, the science is so solid, and you can get it and share that paper and that link to anyone who's questioning you about fluoride. And there's tons of literature in your science.
Just a couple comments. That video of fluoride gate is available through our IAOMT website. Okay, number one, it's $15. The other thing regarding the library, it's in the process of being redone. It used to be available to everybody, but then we couldn't put full articles on without copyright infringement. So we're in the process of putting it behind the sign-in for members. So you have to sign in if you're a member, and then you get to the library, and what we're doing now, we're populating it with the full articles, which we have the vast majority of times, as opposed to just an abstract. So we're in the process. It might be another, it's kind of an ongoing thing. We're just getting it populated. So it's a work in progress, but we certainly already have a lot of stuff on there.
Yeah, it's there. It'll be somewhat soon, but if you go there, that's why you can't get into the library right now. But there are plenty of, like you said, you can get the videos and what have you. But if you want some solid science to share with your doctor, because these doctors are kind of hard to convince sometimes. So, for metals, it's not just the reactions in the metal, but man, the galvanism is huge. And when I remove metals or fillings, and my patient says, you might think I'm crazy, but every time you remove these things, I feel better when I go home. Myself, it's always in my mind, and I will tell them it's the galvanism. It's because I just reduced the amount of current in your mouth. Because obviously, at this point, we don't think anyway that you have any instant relief from the mercury toxicity. You have to detox the body, and you have to emphasize to your patient from the beginning. I'm going to take your fillings out, but you also need to do this detox. And if you're doing quicksilver detox, at least a year, maybe 2 years. And if you're having the help of a doctor, you're going to probably say, you're going to look at your genetics, and you might want to do detox periodically for the rest of your life, because they bioaccumulation. So that's kind of what real concern. The simple question, I can't believe, I look in people's mouth and they have all these metal crowns and metal implants and they have no jewelry on, and I'm like, can you wear jewelry? Oh no, I can't wear jewelry. It's metal. And they got a mouthful of metal. And I mean, this is common. This is so common. And one thing that happens also, by my observation, is that they become, as I've gotten older, Doc, I can't wear the jewelry anymore. I have to wear pure gold. Yeah, because your mouth is causing your body to become sensitive to it, and it can't stand it anymore. So every time it touches you, so constantly, you got an alarm going off in your mouth, and it's talking to your brain, which is about that far away, and you got health problems, and it's because of the metal in your mouth. And this kind of what's happening. We talked about the melisa, and that's the true body reaction to metal is only tested with melisa. And you can send it overnight. It can get there like an hour before it expires if you do the research and you set it up. with the patient, and sometimes you might need to do that. Certainly if you have a patient who's had a hip replacement, don't bother trying to argue with the doctor who did it. But you can talk to the patient and say, you have this systemic problem, you are having now atrial fib 6 months after you had your hip replaced. My bet is you're having, that's a warning, you're having a reaction. And then you can say, if you want to do it, we'll set it up and we'll test here, but I'm testing for your mouth and I'm testing for your hip over stuff. Just and we'll see what it says, you know. And so then, you know, the last but not least, and for me, most recently, I think the most important thing that you need to start looking for is these osteonecrotic lesions, cavitations. Your patients that are coming are going to know more about it than you do, because it's becoming very, very awareness on social media about these jawbone old extraction sites. And even in sites, especially in the maxilla, where they might even have their wisdom teeth, and they have this site behind the wisdom teeth. And so that whole thing, I encourage you, if you're not doing the surgery, you need to get a team, and a team of a surgeon that also gets it. And if you don't have somebody anywhere local, your patient is going to need to fly somewhere. So you find somebody in the academy who is doing this and you trust and you know they're doing it right, and you tell the patient, and now you've done your duty. Your duty is identification. And for the identification where we are right now, everyone is kind of accepting because we're paving the road for this whole procedure, and is maybe a head and neck thermogram to start. And a patient can order that for themselves, and you can get the same thing as a breast thermogram. You can get a head and neck, and you can get both at the same time is what I would suggest. But that will give you an idea of the metabolism. This is the functional. And if you have a problem this side, that side, up here, back here, okay, back here, back here I usually think of maxillary, down here, probably mandibular, but it's not definitely definitive. But start off with that, then you're looking at maybe Panorex.
Panorex, though, just be aware, like regular x-rays aren't great about showing.
No, you're looking at a two-dimensional picture on a Panorex. Sometimes you can see something, and sometimes you can't see anything. That's not the definitive. So that's why the thermogram will take you beyond the Panorex. We got to look deeper, and now the state of the art is, of course, the cone beam.
Great. So
And we're looking for a density dot on the hole and show this negative density dot.
So if you have a thermogram that shows red, you know, or white in an area where it's just hot or yellow, you know, you then send the patient for a cone CT if you don't have one. And then you have a radiologist interpret it if you don't know how to, and that's okay. You know, because God knows that it's not the easiest thing. I think there was a guy that was doing it for $55 in the
Yeah, so you have to, the message is, get a team if you're not ready to do it, but it's going to be, you need to recognize it. The systemic problems with these lesions, I encourage you to watch our latest research coming from Dr. Lechner from Germany, and what we're finding in these associated with these lesions are ultra-high cytokine generation, which you'll find in a person with let's say with breast cancer. They find this RONTIS, the cytokine there, but in the same side, always it's on the same side, in one of these jawbone lesions. The concentration will be 50 to 400 times greater RONTIS here. But we don't have the exact say, okay, it's here, so it's going to be there. But the awareness is that jawbone lesions have this huge reaction, and it has huge systemic implications for your patient, and it's the most pressing thing that we need to don't miss the boat and get with the learn about how to diagnose and get with a team, if you're not going to do it yourself, of a surgeon somewhere, and work together. Call me, I'll do whatever, send me, I'll tell you x-ray, whatever I can do for you.
Question.
Yes.
What would be the treatment for the process? To guide the patient out, like in some kind of path.
So, the treatment, we had a meeting of the minds on Thursday, which I've been having an email thread with 17 surgeons around the world, and we've been talking about this is what we're doing, this is working, this is a good idea. So where we are right now, it's suggested that you should consider to have a doctor who is going to run a battery of inflammatory testing and bone healing quality of the patient before you do anything. And I have that protocol that we have suggested. It will probably continue to evolve, but I will share that with you if you request it from me. That's a panel that you can find a doctor who will do the panel for you. And now you have some goals. Get your LDL at a certain level, get your vitamin D3 at a certain level. So it can take a couple of months to get to the point where you're ready to open the patient up. So that's step one. Step two is open, clean out. Scraping, some say only scraping, some say piezo, some say round burr, but clean, complete clean out. Some do not use ozone, but for the most part, the feeling right now is it should be ozone, if it's possible, at the time of surgery, rinsing out with ozonated water, injecting ozone around the lesion and when you have the hole. And we put together actually a study that we're going to start over the long term amongst us to start looking at all of these things and seeing what's working over the long term. Then, IVC is going to be in there, IV vitamin C, but of course as a dentist in my state, you can't do it. If you have a doctor in office, you can do it, I would do it. If not, well, you're going to have your patient juiced anyway with C coming into surgery and all of those things, but I think IVC would be nice if it's available. Then we're closing it up and saying a prayer to the dental gods and thinking that this is going to heal. And that's kind of where we are with this protocol. Oh, no, I'm sorry. PRF. We pack the socket with PRF. The socket is packed, according to Bolts, you pack the socket solid with the PRF chunks, and so that no saliva. Saliva has some inhibitory effects on the bone growth, so you want to really seal it up, and they do that by packing it full of PRF and then seal it with a membrane, and that's most important. Thank you for it. No bone graft. No bone graft.
Why?
Because would you like to use the bovine or the cadaver? Well, I think I'll pass on both of those. Should we use the chemical from 3M? I think I don't trust 3M. So what we find now is PRF is growing the bone. It's growing. Everyone has agreed that they are seeing the perfect bone. Now the problem is when you're missing a wall.
Yes, because the IPRF stimulate the walls,
yes.
produce bones, but they don't produce bones at all.
Yeah.
You have walls.
But
there is only 4 walls.
Yes. Yes. But I will tell you, I'm not the surgeon, but they are not using anything artificial anymore. Nothing. And everything that we have used has eventually shown to be a problem, or seems to be not, putting cadaver bone into some. I'm going without the bone. For me, I don't think I would do that. But you have to decide what's best for you. But in our talk, no one wants to use anything artificial in any of their procedures. So they're doing as much as they can with this PRF. They're covering it, and this is we say the prayer. Because when we put these things in there, we're finding that what's happening is that you're getting a new cavitation. Because the body is reacting to anything that's not. Yeah, we even have, when we put in the zirconium implant, it looks like, okay, we even have some low-grade body awareness that the zirconium implant is there. So it's not like the metal, but anything you put in the body, of course your body probably is going to be unhappy with it. But we will share, if you guys want, we got Facebook or we have a connection we can share.
So the universal cells machine is they said that it makes a fibrotic scaffolding.
Yes, it does, yes. And you got to research, there's a lot of machines. And my naturopath has one, and he uses it for injecting joints and stuff. He claims that you got to have a refrigerator, or that when the heat of making it is going to destroy some of the blood factors. Seem to make sense to me, but I'm not the surgeon. But if you're going to buy a machine, do your research. And they're getting better and better. And you can get machines that you don't have to pay $10,000 for. You can get machines very inexpensive and that are very adequate. And yes, you get tissue you can use. So you can chop it up, you put plugs, then you put it over the top. In my mind, if I'm worried about that and I have a missing wall, I have my general dentist, or if you are the dentist doing it, I make a suck down and I put it on there, and I might even bond it on there and say we're leaving it there for 2 weeks. And we're going to have this plastic covering over the top. I don't care if it looks ugly underneath there. My bone is going to grow. That's how I would experiment. Please let us know how it goes. If it doesn't work, well, I'm sorry. But we are making the road. We are building the road here. We don't have every answer here. And it's where we are now, and getting away from all of the artificial stuff seems to be like it's much better. And things look better, you know? It's just like that. People are requesting ozone, and you should maybe consider, and you'll find it a tool, you'll use it every day. And certainly after you finish your surgeries, we do day of surgery, ozone ears, ozone nose, ozone injections into the site, and I see you once or twice a week for 4 to 6 weeks, where I am injecting ozone into the site for a month. And keep injecting the ozone. And if you are ozone certified researcher, because that's what you can become, then you're going to find that you're going to have a lot of people coming and they don't know why they want ozone, but they want it. So, that's a common thing for people looking.
Doctor, when you inject,
Do you want to sit down?
when you inject after the surgery, what is it? How much to inject, or how many days, or what do you do?
So and I'll share it on the Facebook, I'll share it on our email thread, but for what we're doing is recommended by Dr. Malika the last time I talked to him, but like you always should say, this is what I'm doing today, so this is another day, maybe he's doing something different, but what we've been doing is 20 gamma, we're injecting 3 or 4 cc's into each site, and including if it's a lower, we're going in and doing a mandibular, and we give it the whole jaw. So, this is what we're currently doing, and then maybe if it looks like it's healing really nice, the last 1 or 2, I'll come back it off to 15 and then 10 gamma. Just to encourage that healing, and then if it looks good, if it's not looking good, I keep it at 20 all the way through, and we're trying to encourage the body to keep coming and heal.
How many days? 1 per week?
1 or 2 per week. Most of my patients travel so far. It's hard, but I write it down. I have a protocol that I print out. I give it to them. If they choose not to do it, I've done the best I can, and that's what we should all be doing, is the best we can. So I do it once a week, every week. Sometimes if it's an exceptional, large, or difficult, and a patient has some complications, I might say, no, let's do it two times this week, maybe 2 times next week, and then we'll see how it looks. We do it once for a few weeks. It's your call. It's your call. You have to do gut feeling, And this is your, if you want to get ozone certified, you might consider it, okay? You can, it's a simple thing, it's a lot of fun, and it's like pays for itself as far as promoting you as a biologic dentist. Root canals, you're going to have to decide if you want your patient to have a dead tooth in their mouth. If you want to, it's like the fluoride thing, only worse to me. But if some people in the academy feel that you can have a root canal, we encourage you to use more biologic materials to fill that root canal. But the general kind of feeling and growing feeling is dead tissue in vital bone is probably a real bad idea. And sometimes you'll see a root canal that might be radiographically in 2 dimensions successful, but when you look at the cone beam, almost every single time you can identify this problem. So when I get my patient comes and we're talking, this is to me very obviously infected. This is a huge infection. Here you can't really see, but you kind of look at there's something. And you have to look at detail. And probably when I started, I was saying, oh, well, that one's okay. This one might be a problem. And now I say, that's probably a problem. This is definitely a problem. And now we got to do our next evaluation. Maybe it's time you should think about this thermogram. Now it's time to do cone beam, and now we can prove that it's a problem, and now we need to get this thing out, and do it out correctly, clean it up, doing it correctly. So here, this one, more obviously is a problem, and I look closely. If you really look closely, you're going to get good at this. When you really look at root canals, look at the teeth here. All of a sudden you lose that ladder lace, Say, okay, that's different than here. It might not be that periapical lesion, but it's different. There's a reason why it's different. It's not a bone scar. That was something else.
Bone scar is an excuse.
Of course.
The endodontists, they see that, they're like, oh, it's a scar. There's no such thing, not in bone. I'm sorry, there isn't.
I put this because I thought this was interesting case that I found on Facebook and on one of my allopath groups, that one that hasn't thrown me out yet. I've been thrown out a lot of groups, I'm proud of it. This, what is this? And so I'm looking, first I'm thinking, well, this looks kind of like there's not very much density here. So this wisdom tooth site may very well be the culprit. But now I have seen this, and I know my colleagues have seen this. I think it's this that's causing this. And then on that, when I said that, an endodontist attacked me and wanted to know, well, how can that possibly be? Well, look here. We have a little thickening up here. Above this hasn't been long term. Look at here. This is sticking over here. It's kind of like, oh, maybe. So then in my story, my patient had a fistula between the 2 front teeth that looked perfectly fine. And I had a root canal on the back. I took ozone to the back tooth, and I stuck it up to the apex, and I injected it, and the thing broke over.
Wow.
So I'm going to tell you that these things can drain anywhere. And the reason that they look good on the x-ray, that looks fine, is because it found a beautiful path of drainage. Why does it need to disrupt the bone? Yeah. And that came from that, I can almost guarantee you. And he shut up when I said this. So It's always a victory when they stop talking to you. Because they don't want to admit that you're right, that's for darn sure.
So, I'm thinking, can ozone be injected when it's in the, not that stage, but in the initial stage, if it's seen on the x-ray, something looks kind of looking or failing, and you inject ozone in the bone?
So, for our feeling, Dr. Malika will tell you in ozone, that's how they treat. And if you're going to treat like that, it's lots of ozone injections, a lot. But the feeling in the cavitation group is they need surgery. But we heard a very interesting by this person who told us about digital thermography, which we didn't know anything about. It's a little bit different. And the big problem, premolar extraction case, I have 2 of them now that I know. Around these beautiful teeth up here, I can see that cavitation lesion on the x-ray. I can see this kind of shadowing in between. I'm thinking, oh my God, what do we do here? Are we going to take out 3 or 4 teeth here? Well, this person shared with us one case where in a healthy person, organic eating, taking their vitamins, a person who's healthy like that, they did it. And these little lesions that are left from the back when they were a teenager, they extracted those teeth and they resolved it and they confirmed it by using that digital thermography, which is different than regular thermography because regular thermography is more general. The digital, you can actually see that the inflammation is above the tooth. So it can, but I don't suggest that. We're not having success with big lesions.
I see. Question, what happened with that? How did you treat it?
That? Well, this is not my page, my Facebook, but this is coming out here before you leave today, and then you're going to look funny. Luckily, it's Halloween, so. But no, we're going to clean that first in my office. I would suggest we're going to clean that. We're going to watch this, and this is probably going to go away. We're also going to check this, and we're going to see if this is also a problem. We're going to do surgery here. We're not going to do anything to this until we clean up possibly what has caused it. And I would expect for it to resolve. Your body will heal itself, So that's how I would treat that myself. It's up to the patient. Hey, thank you for coming. Make sure email if you get a hold of me. Then we'll get so. It's up to you. If you're working with an allopathic doctor, good luck, because they're going to talk them into, we need to get out there today. It's going to turn into brain cancer, And it's a residual cyst. Some doctors actually say just leave it. I wouldn't agree with that either, but I've heard that. I've seen that in my practice. And so, we're talking about this. We know about the cavitations. We know that we need to learn how to do it. And here on this, what am I talking about here? Oh, you're right. There's a front of it. Its number 1 site has cavitation. You can see it on the Panorex. And this is, okay, obviously we have a problem, but then we get the 3-dimensional cone view. This is just a scan this is not for looking at any teeth. It's only for looking at mostly this posterior jawbone. This one looks maybe it's okay. There's probably something there, but you're going to see that on your FMX because we're taking that FMX as well. We're not just taking Panorex.
So for next is the protocol then any extraction gets PRF as a way to avoid cavitations?
This is the current recommendation. Okay. So, yes, all extraction, all clean-outs are getting spun blood and factors. And it's interesting, I don't know, Volz brought this attention or this idea that I'm going to learn about in May, is that the saliva could be one of the factors. And so the other function of that PRF is to keep the saliva from that site. And it kind of makes some sense to me. I don't know what the factors are exactly, but some proteolase enzymes that are in your saliva might be also causing a problem with the healing. So what do we have? Well, we better pack it with the PRF chunks, So Oh, I had that tooth out 30 years ago. Yeah, and your bone never healed. That, you check that, then you're gonna find a hole there. You're gonna open that up and there's gonna be, usually that they look, they're fatty. And you saw it, Dr. Judson, who's an excellent doctor, and if you don't have a surgeon to work with, get a vacation spot in Utah because you're going for one.
And you're also going to find a problem on number 20.
I would suspect that there is going to be a problem on number 20. Besides the fact that
Besides that, yeah.
Yes.
One of the senior policy docs in my office will, I don't know when he does this, if not yet, but you should see if we get root canals done, we'll have him come back with his CP practice stuff. That was an objection.
Yes. I've done, when I was okay with doing this root canal thing, or I thought I could make it okay, I would actually have the endodontist, because I hate endo. Endodontist, just clean it out, leave it. They would come, I would open it up, and I would ozonate the tube with gas and liquid and clean it out, and then go back and fill it. But, or if I was going to say, okay, I think they're okay, then yes, I would also, if it's a lower, I would X-tip a hole next to it, and I would inject it to give it the best chance possible, and then I would wait 10 years and take an X-ray and pull it out, because it's going to be a problem. Because it's interesting, I'm a member of the Endodontist of the World group. Mostly, it seems like people from India are here in this group. And, man, they have, like, I don't know why, but every tooth in the head of their patient is root canal. It's amazing. If you have a cavity, you get a root canal. And I mean, at least what I see on these sites, But they say, they even understand, I'm just buying some time for my patient with root canal. We know that it's going to become infected and it's going to have to come out. And they actually recognize that. So I suggest that during that time, your body, the reason why it's failing is because your body is having to fight that all the time. So, yes?
I have a question. So when you have a patient that comes in with this kind of bone loss, and we know that there's an issue going on, and now you're explaining to the patient, okay, there's an issue with this bone. I went to a meeting last night, or the night before, they were talking, one woman was up for legal ramifications because she went in and she did some work on a cavitation. And she's now in the process of possibly being sued because the patient went to another doctor after she'd done a cavitation surgery. So the question is, when you're working with the patient and you're having this type of scenario, you've explained it to them, you're looking at their health history, you're trying to link all the pieces together so the patient knows there is a problem due to that.
No, I don't say that.
Okay, that's what
So this is, you can get sued. I don't worry about any of this. Okay? So I see this. I know that they have a chronic, on the same side, they have a chronic hip pain. Their doctor's talking about having to do hip surgery in the next 10 years. And I will diagnose this thermogram, conium. Okay? It's definitely a hole. Okay? We open it up, we always take pictures of the goop when we open it up, and you've got this fatty, black, sometimes gray goop in there. And now you have nothing. But then if I like the patient, I know them, and I like all my patients because they're all my friends. I spend hours with them and wish I could spend more. I always will say, in my mind, your hip problem is coming from that, but I would never tell you that. At the ADA calls, I never said that. So, but I'm going to tell you that, and for me, I'll say to my patient, these things have huge implications. I encourage you to read, I send them Lechner's lecture. I send them the lecture. I make my patient aware of the possibility. If I say, there's absolutely no way. And everybody I talk to, I make sure they get it. They get it. So you can't get sued. People are crazy. We work on crazy patients. We're crazy ourselves. So, but don't worry about it. You do the right thing, and you're going to be good.
It's important to have a good informed consent.
Biopsy. You send that thing for
consent.
biopsy.
Right.
Because
informed
if
consent.
if that biopsy comes back and it's osteonecrosis, you've done what you needed to do.
That's exactly right.
Yeah, the problem with the biopsy that we are now, we see the potential when you stick something into this, it can instantly spread those cytokines. And so we're not really advocating for that, but certainly if you're fearful and you want to prove or something, you could do that. But we're not advocating for sticking a needle into it.
And the workup protocol would certainly be protective. If you've done your studies, your blood test or whatever, and once that protocol gets developed, I think that'll be more protective.
Well, of course, we're going to do this. If you weren't here when we were talking about that, we're going to have the doctor with the inflammatory D3, all this health profile to make sure they're healthy, and that actually adds a lot of course, your patient's going to become more secure with what you're doing when you have a doctor.
Yeah, no, I don't mean biopsy before, I mean biopsy when you're doing EG to sample.
Oh, so we're going to do this. This is one thing that we decided we're going to do. We're going to take a histology of each lesion. We're going to record the size of the lesion on the radiograph, and then we're also going to record the size of the lesion after clean-out. And we're going to start keeping this data, and we're also going to look at the cytokine profile of the goop, histology and the cytokine, and we're going to start a long-term study with those 4 parameters. But we're making the road. We just got a little bit closer to home. So, yeah, but don't have fear. Have confidence with knowledge. Do things, don't say things that are crazy. Say things that you think, okay, but I'm not going to tell you you're just going to get better.
Well, slightly different question. What's the position of the Academy on pathogen testing, like AIMS or vital oral DNA pathogen testing?
The Academy, you're testing for in these lesions?
No, it's a different subject. High-risk oral pathogens that are related to, valentines or cardiovascular disease.
I don't think the Perio Committee has a stance.
Yeah, we don't have a position on
No,
that.
we don't. I don't think they have.
I mean, it's acknowledged as certainly an option that practitioners have. Some people are very familiar with that and use it. And it can be very beneficial as far as documenting diagnosis and treatment guidance.
Okay.
Certainly.
The encouragement is not to send it to the lab, is to take a slide. So you should have a microscope, and you should put it on a slide, and you can see the bugs. And if you're real good at microbiology, you can name them.
Like a microscope, right?
Yeah.
So
that's enough.
Is that a position for the Academy?
We do encourage people to do perio treatment according to microscope therapy. Kennedy is huge on that. And a lot of docs are doing it, and the end point in your perio treatment could be the disappearance of the parasites that are on there and things like that.
Good.
So yeah, it's good at the Academy, but we can't, it's a good idea, and it certainly helps you motivate your patient, and that's the big thing. The lab problem is if you send for a culture, the culture determines what you see. You can only test for certain bugs. If you send to the DNA people, I think there's 99 bugs they look for. I was trying to connect with a new machine that's a DNA testing. It's claimed 600,000 different bugs. So it depends, but as far as what do you do with that information, it's proof to the patient that there's bugs in it, So these are the must-read books. If you're going to be a biologic dentist, you need to know what these books say. And of course, every patient, almost 90% of your patients will know about Western price, and so you need to at least know exactly what Western price says. And you saw it in that airway thing is based upon Western price information. That our bone structure is not right. This is going to, if you still think that brushing and flossing makes a big difference in tooth decay, you better read this book right here. I say to my patients, if depends on what we're talking about, but brushing seems to be more like knocking the numbers down. Certainly beneficial to the person sitting next to you, but it's not really, it's not the key to preventing decay. The key is diet. And this is the most interesting book that you'll have to probably pay a lot for. But this is the behind-the-scenes information on how the cover-up has happened about these osteonecrotic lesions. And this is a PhD paper that's beautifully done. It walks you through the whole thing. It's pretty cool to read the history, you know? So for the best, you know, people want to know how do I advertise your best is website. We're doing social media so that if you become SMART certified, I guarantee you people are going to be searching for SMART, and we will be sending them to you. And for me, we generally say look for the tree hugger magazines around your area and put some tree hugger ad in there, you know. And those are your best bets. The website, and the most important part of your website is optimization. And for me, this is the group that was here that has that form. You were asking for the, they have those forms that you could put on your website. And they're also really good at optimization and very reasonable. And they've got a website. So I encourage you to consider to talk to Dory, and they can help you. So the SMART certification, of course, because of the Academy, we're on this all-out, educate the world about SMART. All you have to do is become SMART, and then you can get SMART cards to give to your doctor. I'll show you. It does not. This is what I use for my card. I don't. It does not have my name on it. It just tells. Then you can give them to your practitioners, and you can say, hey, you know. Oh, I guess I only have two. Sorry about that. So. Yeah. But anyway, so if you could pass them, that'd be good. Because you put them in your hand, and there's something special about them. You can get them from the office, and then I send them out to my practitioners who actually are recognizing that and now they don't have to say, oh, go to my friend Dr. Wisniewski, because they can't say that. But they can say, make sure you have your metal out with by a smart dentist. When they click on that, I know because I'm the most smart guy around. So I can give it to all my doctors. And even if there's a couple of them, your doctor feels more comfortable just giving, they're sound intelligent. Use safe to get it out. And that's the most important thing. So in those cards, pass them out. And now, what I think I'm going to do also is send some package of toner blades and disposable mirrors to my doctors. I'm serious. They're going to get tongue blades and they're going to get disposable mirrors. I'm saying, let me know when you run out. Because I'm happy. And so this is, we're doing this professional outreach program. And we are going to different meetings. This was the zirconium implant meeting where I was talking to Dr. Holtz. And he has a whole protocol, but he doesn't have exactly SMART. And I shook him up a little bit. I said, you missed it. Because he's pretty darn good, man. He wasn't too happy. But he wasn't covering the patient's face and some things like that. But this guy's, he's doing it from his heart. And so anyway, we're spreading the word everywhere. We are so effective by going to these meetings everywhere and telling them about SMART, that if you're SMART certified, you're going to get patients. You're getting patients. And if you don't do it, what people are on Facebook yelling about is, people want to know what the heck is going on here. like, hey, my doctor didn't even use it, damn, I don't think it's right. So, you know, you're going to be part of the resistance here, you know? And you have to either do smart, or you're going to maybe become going to this party. And so I think that in the academy you don't have to be smart certified, but I'm just saying that you're going to be faced because of the awareness of the people. Nice. The people of the awareness of the of people are going to be like saying, oh, you're a biologic dentist, but you're not smart certified. So there's a damned if you do thing, you know? And this is, you know, you don't want to be labeled, you don't want to be invited to that party. So sometimes people want to know, I don't know if you guys, anybody have questions about teaching their staff? And so this is always a problem and a big, people are freaked out about it. And so what happened for me, when I came to my first meeting, I went back and I said, wow. I said, we are getting poisoned. And my staff was all ears. And because, you know, my staff loves me. I'm a lovable guy. But so we immediately got excited about it. Sometimes there's resistance, especially the hold it down. But what I did was I took the videos, and maybe you might consider, we have online learning. You might even pay your staff if you have that kind of relationship to watch the videos, to get educated, and then show them that we're breathing this all day. Maybe if you can even, we have in the academy, you can get a Mercury 3000 sniffer, get in line to get that, and now you can bring it to your office and you can say, look at the garbage when we're throwing our gloves, it's got gas, mercury coming out of it. Look at over here, mercury's everywhere. Your assistant might quit or work harder. So you have to find, you know, teach them. Don't be afraid. Go to them and say, I'm worried for all of us. They get it. I mean, they're human. Yes?
I will tell you truthfully, the best thing you can do is bring your staff with you to these.
Absolutely.
My team, I have learned, if I come by myself and I go back, nothing changes. If I bring them, oh my God, going back Monday morning, they're like, what can we do to make things better? And so my team is all.
They don't want to be poisoned. And you come back, you just learned. Don't worry about what they're going to say. Don't worry about what your patient's going to say. You know. Just get the confidence. You don't need it. Okay, I don't want it. My staff, I'm still teaching her. She's like, kind of throws her robe, you know, there, like, after we're done. I said, hey, that's off-gassing. Get it out the door. She's like, we're all going to be dead if we're worried about that. I'm like, you're going to be dead if you keep doing that. I thought, because I was going to kick you in the rear. I don't say that, but then you get the idea. Make them aware. As you become aware, because we became aware that, you know, we weren't removing, as soon as the mercury's done, we get the tip off now. Because it's loaded. I'm not opening the mouth and then putting the tip back in there. So you become aware. Maybe you weren't doing that before. Don't lose any sleep. You're doing the best you can. Yes?
At the IAOMT website, there's the resources section. And if you follow it down, there's online learning, and you can, the left side is for credit and the right side is not for credit. And it's got 10 modules in there, and they're maybe 40 minutes, so it's great for a 1-hour staff meeting. That Mercury 101, Mercury 102, Mercury in the environment, safe removal, all of those things you can educate your staff, and they're willing. They want to know.
It's beautiful information. Buy them lunch. They love you more. You want your staff to love you. You buy them lunch. Then sit down. We're going to watch this today. Sure, you might think it's boring, but I'll tell you when you watch it, it's not boring. It's like, oh wow, you know what? And like they get motivated. That's perfect. That's what I say. You know, you show them the videos. Buy them lunch. Get them chocolates.
There's other videos.
They love you. They just don't know it yet.
Part of it is a training thing. Just taking 20, 30 minutes, like I sell the microscope, the phase contrast.
Yes.
And a lot of doctors have trouble integrating it into their practice, like the hygiene department, for instance.
Yes.
And it can be really fast. It's not a problem for it's an asset to the practice.
Of course.
Even the hygiene department, if you train them correctly, it takes 3 to 5 minutes. And so you just need to just show them how to do it.
Yes.
And so, and the microscope is so visual, it adds so much to your patients and to the practice.
I agree.
Compliance.
You come out and teach. First, you got to teach the doctor.
Yeah. Well,
Then the doctor has it.
Right.
Because I have that hurdle in my mind of how am I going to find the time in my day that I already have no time. But I think that absolutely that the education thing, the microscope, huge, right?
It's more than because it's so easy to do. If you do it right.
And it's fun. I mean, when you see those slides, it's like, wow, that's pretty cool stuff, you know?
Yeah.
And so you're wowing the patient when you have the microscope. It's wow.
Yeah. So if anybody has a microscope, I can Skype into your practice and show you how to use it really quickly. Or your hygiene department, your hygienist. Because the hygienists have to be on board.
Oh, of course.
Can we maybe get your name?
Sure. Just email. You can email me. Just dro@myholisticdentist.com, and we can set something up.
You gonna put that on the Facebook group?
Yes.
Okay.
Isn't it fun to run a group?
Yeah.
Please put that out there because that's valuable right there. That's valuable information. So yeah, when you go back from this, don't go back quiet. Go back talking and excited. Lodge e-learning, and then most importantly, bring them to a meeting. And the hygiene people, you know, get them to stop putting fluoride in. I mean, it's a tough one. And it's a tough one to find the hygienist. So you got to find it. You got to do it. You got to, you know, it's the hardest part of the puzzle to fill. And teach them with the e-learning and the online module about fluoride. They have to wash it. Give them some science. Take away their pay if they don't put them in fluoride. You have to, you know, sometimes it's like, okay, just be quiet about it. I don't know, you know. They'll get it eventually, it's poison. But I think that most of them will be happy not to have to stick that fluoride tray in the kid's mouth and watch them start throwing up because you just gave them 20 milligrams of fluoride all at once. It's like a great thing to do. I wonder why the kid's sick. This has been changed. We're now meeting on this date in Bled, Slovenia, for our third meeting. So if you guys are looking for vacation, this is going to be an awesome meeting. You will learn more about osteonecrotic lesions. This is the date, but it's in Bled, Slovenia. What happened was we scheduled this on the word of a doctor, and then we found out there's a biologic dentist meeting before, the week before, the week after, and they had already cracked the market, so we were like having such slow. We said, you know, we're going to go back to Bled. I wish I had a picture of Bled. It's at the foot of the Austria Mountains, and it's a beautiful lake. And I'm a founding member of the IAOMT Doctors of Europe, and I see these international chapters as going to be the most huge growth in the academy. It's coming, and we have 10 international now. A new one is in India, another one in South Africa. Europe was before. And so we're getting all of these startups, and these meetings are fun, man. I encourage you to think about taking a vacation and checking it out. So we can talk and do whatever you would like, all right? This is how I look on Facebook, and this is why they kick me out of all my groups. And Yes.
I'm sorry, so really quickly then, as a new, somebody new to the academy, what would be the, because it's tough to do it all, just like my friend said earlier, so smart certification, getting the team members on board. As far as spending money, what would you recommend be the first one or two key things that you should?
So first, you must be firmly educated. Read those books, know what you're doing, because if you're asking, when I started, your first year, you're going to say some things that you're later on going to say, I shouldn't have said that. So I always say, this is how I think about it today. About everything, even now. They want to know about, what do you think about, this is how I think about it today. Well, what do you mean? Well, I read every night. I'm kind of a nerd. Tomorrow, call me, because I might change my mind. But always say, this is how I think about it today. Then, to spend money, I would spend money on certainly the SMART certification, getting all of that equipment. You need to have that because you're poisoning yourself every minute. So you need to follow the protocol because for you, your staff, and the environment. So that is number one in my mind. Stop poisoning everyone around you. If you don't care about your own health, at least take care of everyone. Then for people, having people to come to you, optimize a proper website, and optimize your website. The Academy is doing your advertising for you. If you have an optimized website for to find Biologic or even holistic dentist, so that your site pops up in your area, anywhere in the 3-state area or something, you can, that you're right on top, you got it. You know, you got the people who are looking. That's where they look online. That's where I would spend all my money.
Right, so equipment-wise, clearly what you want is that big vacuum cleaner that sits right here, right?
Yeah. All of it.
We call it lumpy.
Yeah, I mean, that's the most costly part, is the
It's
airbag.
$1,000.
But I would tell you something else that we know, and that, is that when you're sterilizing, when you take all of the instruments that were present during the mercury removal and you put them in the ultrasound, a cloud comes off. Then when you take them out of there and you put them in the sterilizer in your autoclave, and it opens up, a cloud of mercury comes out. So what we did in our office, because I just haven't got around to it, you should have a chemical hood. If you're designing an office, you should have a chemical hood over your sterilization area. But if not, I bought Faustus. Faust wasn't here for some reason, he always is, but he has the most quiet elephant trunk. And it's got a bigger footprint, and the trunk does not, you have to, if you're going to use it in the op, you have to lay it on the patient because it doesn't stand up. But it's totally quiet. It runs 24/7 in my, and I've got it over the area where we do our sterilization. I've got it, so when that door pops, it's getting sucked right up. Pardon?
What is his name?
Faust, F-O-U-S-T is the company. If you Google it, and he has room air filters, which are with the activated charcoal filters. They're very inexpensive. You can put those around and wherever you want to.
Those are like $2,000.
From Faust, you can buy
The big machine,
the huge
the
one.
big elephant trunk, that thing's $2,000.
Oh, yeah. No, I think you're 1,500 or so. It doesn't matter.
Yeah. Because we priced
It doesn't matter. You have to pay the money.
Yeah, no, but just know, this is why you end up charging for your smart pro.
For every patient.
It's better, I think, if you have the room in your operatory to put two.
They're small, those 10 bags.
Oh, the den bags, yes.
And they suck enough, it gets everything.
If I had a den bag, I would definitely have two.
Yeah.
I have an IQ Air, which is a little bit more powerful, but even that, the footprint's larger. The smallest footprint is and it's very adequate, but the amount of air moved is like, we have
so much more.
Yeah, so IQ Air is more powerful, and if you have room, the IQ Air, but it's more expensive. And you know, so they all have their little thing. The footprint is usually the limiting which one you can buy is where you can, how much room you have in your operatory to put the unit. So, but then those charcoal filters that I'm talking about for your room air, because the HEPA filter actually concentrates mercury and it makes it worse. You need activated charcoal filters, and they can be, you can buy one for 100, you can buy them for 300 or 400 or something, and put them around your office, and you can hear them, they're not too loud, and then when you get bad like me, you can't hear anyway, you hear nothing.
I would like to ask you something. When the patient comes to the office and they don't want extra help because they are afraid of their
That's already discussed because they filled out my forms. Then I've reviewed them. I see that, okay, I can maybe help this patient. They're taking 10 medications. They know that they have all these fillings, and they say they want to come and get them out. So then, do you want to add something, Jack? Right?
Well, yeah, relative to, you can give them an option. I don't know if any of you got by the booth that was here called Cell Power. Dr. Barry Tan has lectured to us numerous times now, and there's a form of vitamin E, or there's 8 forms, and the delta tocotrienols are very protective against radiation. So you can give them the option of getting hold of the delta tocotrienol. It's not vitamin E, you got to look at the details. It's not like the alpha tocopherol, it's the delta tocotrienols. But look up on your app the exhibitor and or Google delta tocotrienols.
Delta tocotrienol, but you got to buy it from.
Well, ideally from Cell Power, because what they do, they keep it refrigerated in storage. It's very sensitive to heat.
So if the concern for the patient is radiation exposure, then the radiation does its damage by free radical generation. It's that there's no magic. It's not this piercing ray from Flash Gordon that is causing a problem. It creates free radicals, so you load them with antioxidants, and you're safe.
Good.
And this particular tocotrienol has been shown scientifically that it actually helps against it.
You can go to the website x-ray-protection.com. And really important for CBCTs, because that's a higher dose.
I don't work without an FMX, I'm sorry, it doesn't happen in my office. And so they know that coming in. When my office staff calls them, they're told, if you want to come here, you have to have this, if you don't want to have this, we can't see you. So you either bring it to us, if the doctor doesn't ask for a lot of x-rays, but we insist, we got to, I'm not going to work on you without having adequate assessment of my patient. That's what you're paying me for. I'm sorry, I'm getting into the conversation. What can we do on those filters? With all of, pardon me? Oh, the carbon filters. Well, and with the room filters from Faust, you can send them back to him, and he takes them to the magic recycling. For the IQ air filter, we don't have an answer for that. I would say you call your city, they're going to tell you we don't have an answer for that, and you're going to throw it in the garbage. Because we don't have a way to recycle the filter from these machines. I think that Faust is, when you can also send the filter back to him when it comes time to change your filter. And unfortunately, mercury amalgam is not poison, so we're not talking about it. We don't have an answer for you. It should go back in the ground where it came from. So I say you have to throw it in the garbage. I'm sorry. I don't know. I would suggest mail it to Washington, D.C.
Other question. When you have a kid,
Yes.
and the parents that they want to be sedation, but the kid has another thing, and the kid is not cooperative. Then what do you do?
So for me, no. Yeah, for me, I don't shoot very many x-rays on kids, for obvious reasons. But if you have obvious decay problem, I would shoot one bite wing on each side but this is what I do. You have to decide for yourself what you're comfortable with to assess. And I have yet to see a parent that didn't say, oh no, you're not going to take an x-rays when you got mouthful of cavities, you know. So it's really not an issue. If you're going to treat kids, then you find where it's comfortable for you and do it. If I have kids, and remember I have no fears, if I have kids and I see no sign or anything about any decay, I don't take it.
Yeah, but if you have some decay,
She wasn't asking that.
Oh, I'm sorry. I thought you
the
said
kid has a lot of decay.
lot of decay.
And they don't want to have the sedation because it's in state of therapy. But also, and the kid.
Oh, uncooperative? I send them to the evil Peter Donuts.
That they don't want to be over there.
I know they don't.
want to put the sedation.
And what I don't want is to have a screaming child in my chair. So I can't handle it. I understand that I refuse to papoose them. I don't want to be involved with sedating them. And if you're going to put ozone on a lesion, it has to be 2 minutes at the highest dose that we have on the meter. And if that kid takes a breath of that, you've got a coughing kid for about an hour and a half. So I don't do it. I'm sorry. I'm not, I can't do everything. And I do the best I can. What I do to that is I sit down and I have a real thorough conversation about their diet. And if I don't have time to do that, they go to my functional medicine doctor, because the problem is not your brushing, the problem is not that you're not flossing, it's the diet. And the whole family has not a good diet. This is a reflection of what's going on in the family. And so they have a strong recommendation to go to my functional medicine doctor and sit down. And I said, do you want to cure this? Well, you're going to have to fix the lesions before they lose their teeth. So you've got to go to the evil one. My guy has done the composites for me, at least, But they go to find out what's wrong with their diet. They're telling you the whole family has got a problem with you.
Okay,
Yes.
what I do, I was going to.
Okay, yeah, tell me.
Okay, so what I do, if I've got an uncooperative kid, is the parent holds the child while I do the silver nitrate and potassium iodide. Okay? And we tell the parent, okay, we're going to try this. That's if the lesions look like they're smaller.
Yeah.
Okay. If the lesions are larger, I tell the parents point blank, I am not willing to traumatize your child by tying them down. PTSD is a very real thing, and I have to deal with neurotic people who have been traumatized as children, for the rest of their lives. So I categorically refuse to traumatize your child. Now, I have a wonderful anesthesiologist. Thank you, God, he has decided he's not vaccinating his children. He's wonderful. He comes to my office. The child goes to sleep in their parents' arms. They're not intubated. We bring them back. We don't intubate them. They're breathing on their own. So it's sedation, but it's not intubation. It's not general anesthesia. Okay? And we do the work that we need to do. That doctor never leaves that patient's side, because the parents are very afraid that their child's going to die.
Yeah.
And I tell them, the children that die are the ones where the parent does not have, where the doctor does not have an anesthesiologist there. If an anesthesiologist is there, those children don't die. The ones that die are the ones where the doctor, his attention is divided, he's trying to get the work done, and so on and so forth, and they can't pay attention to 15 things at once. My anesthesiologist, his only job is to make sure that kid stays breathing. And so that's what he's there for.
Yeah, you have to decide what is
Yeah.
best for you.
Yeah,
You
decide what's
can't
best for
consider
you.
it.
Exactly, and he stays there, he doesn't take a break to go pee. You see what I'm saying? So I do my best to try to reassure the parents. If they still refuse, you know what, that's their problem. We do the best that we can. They will be back.
Yeah.
Because when that child is complaining of pain and they're crying all night, they will be back. And at that point, it's going to be more expensive. And we're going to end up extracting teeth on a little one because they didn't pay attention. We do the best we can. All you can do is informed consent.
educate your patients, talk to them about diet, talk to them about all of these things, but at the end of the day, go with what your conscience says. If your conscience says this child needs to be sedated, then you sedate them. Do not traumatize them.
Okay, thank you.
What does the holistic dentist do when one of their patients calls at 7 p.m. on Friday night complaining of pain and swelling?
So for myself, I'm very lucky. I say it's because we are thorough. I don't have that kind of practice. It hasn't happened to me. But if someone calls me on Friday night, and they always say, this has been hurting me since last Sunday, and it's killing me today. I used to get angry, now I go, okay, be calm. And then it's a time for an antibiotic. You're going to have to probably surrender to the antibiotic unless you're committed to the point where you want to go into the office and maybe do some kind of procedure to ozone injection and what have you. But I generally am not doing that. I will use, there's a place for antibiotics, but I would immediately want them to see the right person right away because I don't want them on antibiotics for a week before we see them. So I try not to do any antibiotics, but that's in that case, an emergency problem. I mean, they get relief, and your immune system sometimes needs help. The reason that they have the pain is your immune system can't take care of the bug that is actually growing there, and it's causing pressure. And so, well, let's give them something that will take care of that bug. But I don't want it long term, you know? Does that answer what to it?
So would you give a short course?
I give them for a week, and I cut, and I tell them, hey, we're going to get this taken care of. I don't know that you need them for a week, but you got it.
What about
I don't get involved with anything more than the antibiotic. I suggest that if it's analgesics.
Oh.
I tell them if it can tolerate a leave, then I would take a leave because it's really the best thing there is for pain. Yeah, but I'm sure there's good herbs. Turmeric. They will take care of the pain like that.
It's equivalent to 800 milligrams of water.
So you're taking how much?
500-600 milligrams of turmeric.
Turmeric. There you go. I'm glad we have that. Thank you.
That or arnica?
Arnica, yeah. So for the vibrating water, you can take some of that. And then turmeric, I love it.
And at the end of the day, when I put my patients on antibiotics, I tell them that they will have to be taking probiotics from months to undo the damage. I hate having to do it, but you know, when we have, there's a place for it. So
how much is the turmeric? How is 100% effective, or how effective do you think?
Oh, 100% effective. For my cholesterol panel, or diabetes, or chronic inflammation, for pain, 800 milligrams.
You're taking raw organic, or are you buying it in pill form, or how are you taking it?
I'm taking it because it's concentrated.
Oh, concentrated.
Yeah.
So what brand is
there's
well
a
absorbed?
brand that I know about. It's called Cosmetic. Let me find out. It was on the Truth About Cancer, and it's amazing. Let me see if I can. And it's wonderful. Let me see if I can find it. Yeah, here it is. It's called Sangiovani Bosmeric SR.
You're going to put that on the Facebook site?
Yes, sir.
Thank you so much.
What's the name again?
I'll pass around the pictures.
Can I ask a stupid question? How, as we in office, does the ADA attack you if we put biological dentistry? What is the best?
So the way you have to say it is, I'm a general dentist practicing biologic. You cannot say I'm a biologic dentist. That's a category that doesn't exist. So you have to say I'm a general dentist practicing biologically, providing biologic treatment. You can never say the only time you get in trouble, and they've backed off on us on the whole.
It's really the state board.
It's the
not
state.
necessarily the ADA.
It's a state by state, but they come after you when you start saying, I'm doing this better than someone else.
Or I'm going to cure your depression.
One person said, I am the safest mercury removal dentist in the entire state, all right? And they just asked them, they told them nicely in a letter, you can't say that. So then you can say, I'm smart certified, that I practice safe techniques. But you can't claim superiority over the mindless. Okay?
So like this term biological dentist will not create a red flag. See, it's California demo.
I'm not in California, so I can't tell you that.
No, you can't, you can say biologic dentist, but I would advise you not to advertise it as, yes, no, biologic dentistry. Okay?
You need to say holistic dentistry.
If you're going to practice holistic, which is different than biologic.
Yeah.
So it's a very definitive difference.
One way to limit your liability or problems with state boards, particularly on your website or any kind of marketing you do, is to say you're an IAOMT member, and hopefully you become certified if you're not already, and send the patients a link to the IAOMT. Let our language on the IAOMT website explain without getting you in trouble. And all you're stating is that you are a member and you are certified or accredited or whatever, and then the patients can connect the dots. If you some of our members that have gotten in trouble have said some stupid things on their websites, and that's what's got them in trouble. And we have an attorney that offers some services, like the first hour is complimentary, but if you get into trouble, he knows this issue inside and out. He's been involved with our academy for over 25 years, and he's actually helped many of our members who have gotten into some trouble with the board. Sometimes just an initial letter, depending on what the seriousness of the transgression. If it's something kind of minor, because we actually had one of our members, I think it was out in Idaho, right when we were starting the SMART program, and when the board got in touch with him, got in touch with that dentist, and something about what she had on the website.
That was the one. I have the safest mercury removal.
Yeah, but they did kind of back off when it was clarified about the SMART certification, and they even contacted the IAOMT, and this attorney explained it, wrote a letter, and she was okay. But a lot just depends on the state. Some states are more aggressive.
Yes.
But just be smart and be careful. And actually, our website has a very nice article about staying out of trouble with your board. And it goes into some of just what I've said. And if in doubt you can't find it, call the office. We'll help you.
Thank you. I think that's great, something that I was kind of ignorant about there. I didn't know that it had such pain relief.
Yeah, it's really good. It was on the I went to the Truth About Cancer because of my history, and I learned a lot there too. So it was quite interesting.
But I think that, are you guys thinking of what you're going to name your practice? So, when I talked before, mine is Copelli, and I have science-based dentistry, and I wouldn't put on my sign biologic dentist, because I don't think you get called on it, but they have basis to call you on it. And then we have heard about this being called out because there is no category for this kind of specialty. So have fun with your son and do something good. You don't want to put that boring biologic dentist. Yes, sir.
So just to kind of clarify, the alternative to pain relief would be generic. The alternative to antibiotics would be
It's going to see them.
So beta-glucan. There's a company that makes a very high-quality form of it, transferpoint.com.
High-dose garlic. The Russian antibiotic is garlic. If you have knowledge in herbs, I am sure that there are herbs that you could recommend that would work. I can't tell you what that is. So I would say if I knew more about herbs, I would probably tend to, on that first call, try to give them, but at night they're not going to be able to get herbs, Of course, the drugstore is open like 24/7, so unfortunately, you might be faced with that. But if you have herbs or something, or you have that knowledge of being able to recommend that, then that would be better in my book too. You know the problem with antibiotics as well as me. They're showing lacerated mitochondria with antibiotic use. So
It would be great if we have something that does what they do or functions as antibiotics function in those scenarios that are not pharmaceutical.
it would be good.
There are natural options, things like oils, things like oregano.
Yeah.
So so the idea is basically garlic. The idea is that there are things out there, but at the end of the day, there is a place for antibiotics.
Yeah, and if something ever happened, certainly, and you're not a herbologist, and you're recommending that, I mean, I don't fear this at all, but I would say, in the end, the board would say, why did you give antibiotics?
I'm always prescribing antibiotics, and they tell me
I don't.
You have to take it. I'm not there, at home making you do it. Like, yeah, I get that. I'm just wondering, what is the practical alternative? I'm new to this all. I have this existing framework of, I have emergencies, so I'm infected too. I do this. If A, then B. What is the B now?
Well, I want, we're going to have this beautiful Facebook site where we could actually exchange that kind of, this is what I'm having luck with. Like I say, I'm kind of, I know about this oil, oregano, and the garlic, but I'm a little bit short of recommending it, only that unless the patients say, I don't want to take antibiotics, these are the things that I know about. And I feel like I always want, a herbologist to do it, the person would really mind. Or in our group, if we know that this works good, then I would feel more confident.
We need concrete answers for this for everyone.
Absolutely, absolutely. Scientific studies. That's what we're lacking, scientific studies. Yes.
That's where I just wanted to add that turmeric also has antibiotic property, but again, I'm from India and my grandfather practiced a lot of Ayurvedic medicine.
Yes.
I know that for sure, but there was some scientific evidence or study that
This is the problem, the scientific study.
Turmeric does have antibiotic property. That was what I was raised with, and on our group I did mention my kids have never been on antibiotic. Every time they have a cough, cold, every morning they get turmeric in warm water because turmeric, salt, and water, the way it reacts is a good antibiotic. But it has to be in a proportion. Turmeric powder with salt, pinch of salt, and water, warm that, not boiled, just warm that is a good proportion. It has to be had before eating or drinking anything. So all these herbs have some properties, but they have to be studied really well before you recommend. Another thing about garlic is it's also a blood thinner, so if your patients are having any kind of cardiac issues, they're on any kind of coumadin or aspirin, you cannot contradict. You cannot give garlic, it's going to cause blood to get moved in.
Yeah, this is the perfect point. That's why I don't go down that herb thing.
Yeah.
I don't have the knowledge that she does, but in our group, we could come up with some protocol. But the IAOMT is not going to give you that protocol unless we have science. Science to show
More
it.
patients need to make their own
That's why you won't get it from that.
So what do you cover your
But if we can come up with something and have a study and have the science, then yeah, we're going to, none of us want to give antibiotics.
I can't,
They're not using antibiotics after the cavitation.
If you want to take whatever it is you want to take, you go ahead and do it.
They're not
Or you
using
have to do whatever you want to do. I'm going to prescribe, because that's the law. That's what I tell my patients, and that's where it stops.
So if they don't take it, it's okay, but you have to give a prescription. You have to document it. After that, if they don't take it, you don't know about it.
Yeah, exactly. If your butt is covered, always, always, always protect your license.
On the beta-glucan, like how much of the dose, or it does really help with the abscesses, or it's just like for a milder infection?
I would say you got to make the distinction between acute and chronic. And it's the concept of host resistance comes into play here, because what beta-glucan does, it's stimulating your immune system to be more effective. And on the transfer point, if If you register with them as a provider, you get access to a lot of the research articles that have been published on it. I think they have a video. 500 milligrams is typically what you're going to find. It's like this transferpoint.com that they sell. And it's been on the expensive side, but of course as a provider you can get it at half price. Instead of, I think it's about $75 for 60 capsules, 500 milligrams.
Yeah, that Cosmetic is expensive.
So you do it every 6 hours?
I take mine, like when I fly, anytime a trip like this, I bump it up 3 capsules, first thing in the morning, empty stomach. Or during the flu season, you know, and I've been around all my grandkids, snotty-nosed grandkids that have been sick and all that, and they just came out with one for the kids, little chewables for children. So again, don't look at it as an antibiotic. If somebody's swollen and all, they need more than that. Although you could give that, but and you can offer that as just one additional thing patients can consider.
I should look at stuff they leave for me. I do not have any financial interest. Although I should, I need to invest. Yes.
For a person with a limited budget that's doing a startup build out, what would be the priorities in terms of buying the necessary equipment for biological?
If you're doing a build out, and you're seeing what you prioritize towards doing build out. Chemical hood over the top of your sterilization. And a dirty room.
Well, which we do emails in. They help
when people are doing, they putting the patient in there, the door, it's a separate air system. You're removing the mercury and then getting them out and putting them in one of your other laboratories to do the restoration, so that if you have multiple dentists or if you want to do this kind of dentistry, you can start another mercury removal one. So dirty room, because what we know is our office is every dental office has a level of mercury. And even in my clean room, while we're doing as much as we can, and now we're learning that maybe we can do some more, that there's a level. You breathe it every day, all day. If you're at work, you're breathing. So the dirty room to me is a big thing. And of course, some kind of, if you have access to go out the building overhead, the chemical hood is very inexpensive than just a fan that goes out. But if you can't, many people are in the building where the situation they can't go out, then you should somehow build the space so that you could put one of these spouse filters over the top. You know, they have an extra long trunk. You could maybe have a space in the sterilization cupboard where it is, and then have that way hanging for them to take care of it. Then you're eliminating poison. That's kind of, you know, there's a lot of other details, but that build, I would put my priority there. Makes sense.